Our staff cry daily.
It's like someone's tearing away my heart. It's taking a part of my soul with them. Because we become like family.
New at 6, frontline heroes. We're hearing from local nurses tonight about the reality that they face every day, caring for our loved ones, fighting COVID inside nursing homes. According to the Centers for Medicare and Medicaid Services, 19 of every 1,000 nursing home residents in Oklahoma are dying from COVID symptoms. Traumatic for their families and the nurses who are at their side. 2 Works View's Mason Morrow gives us a sobering look at what these nurses face every day.
They can't do this anymore.
We're tired. Honestly, we're tired.
7 months, 12 hours every day spent looking after the highest risk coronavirus patients in the country.
We have to watch our every move around people.
Nurses inside the COVID units of long-term care facilities in the Tulsa area are pushed to their limits. Covered head to toe in heavy personal protective equipment.
I have an N95 that I wear. And then I have a face shield that goes over that. I have to wear a hairnet.
Running up and down hallways for hours on end.
Oversized jacket that I wear on top of that. It covers from my arms, like down, all the way down. And it gets hot in those, it gets sweaty.
It's physically taxing.
It's just, it's exhausting.
The emotional toll on COVID unit nurses weighs even more.
Our staff cry daily.
It's like someone's tearing away my heart. Taking a part of my soul with them. Because we become like family.
Since visitation from families or friends is prohibited for residents with COVID, their bedside nurses are their closest companions. Jessica Hunter, a nurse in Franciscan Villa's COVID unit, says the bond she shares with their patients makes it that much harder to watch them struggle.
I've literally had patients want to give up. That says that they can't beat this and that they're done and they don't want to keep going forward anymore.
She's seen 2 of her patients lose their battle to the virus. The final moments stick with her even after she's passed through the pressure-sealed doors.
I've cared for this man for that long, and then he's gone. All of a sudden, he's just gone.
The touch of a body she placed in a bag 2 hours after death burned into her fingertips.
It was just so hot. And I mean, I know that's weird for something to stick with you, but that like breaks my heart. Like her body was just hot. It shouldn't have been hot like that.
Hunter tells 2 Works for You the trauma forces her and fellow nurses to question whether they can continue. The idea of tearing off the sweat-inducing scrubs and leaving them behind, a tantalizing one. But to Hunter, it always comes back to her patients, the stress, a burden she's willing to bear.
I know that my patients need me. And at the end of the day, I need my patients.
Hunter tells me she, another nurse, and a few aides look after about 20 residents within Franciscan Villa's COVID unit. She says nearly every other week a patient dies from COVID or is transported to a hospital in life-threatening condition. Kimberly Green, the COO of Diakonos Group, who you saw in the story, oversees the facility and others in the state. She says nurses are calling her almost daily, saying they're going to leave the healthcare industry altogether. She says they don't have any trouble bringing in replacement staff. It's just maintaining nurses that's she's found a challenge. Reporting live, Mason Morrow, 2 Works for You.
We appreciate them so. Well, Green says that all of their facilities offer telehealth counseling sessions for the nurses. They've also arranged for in-person counselor meetings.